This institution has provided high-quality healthcare and teaching to medical students and has trained some of the best doctors who continue to make tremendous impact in medicine globally. It is therefore laudable that in the last half a century, UBTH has become a key pillar in our healthcare ecosystem in Edo State by serving the healthcare and medical needs of our people and Nigerians at large. UBTH has continued to save lives, has continued to care for the sick, and to provide hope for those with life-threatening conditions. We recall with appreciation how during the COVID-19 pandemic, UBTH played a vital role in firming up our response mechanism by providing the necessary human and institutional support for preemptive and effective response. They have proven that in times of emergencies, they can respond adequately to ensure that members of the public are protected and get necessary support to survive deadly pandemics. It is imperative to reiterate the call for a more dynamic and functional model for financing tertiary educational institutions in Nigeria through the robust partnership and collaboration with the private sector in order for us to build a resilient and sustainable healthcare system. Emphasis must now be focused on health financing. Government alone can no longer carry the bulk of the cost of providing healthcare services, particularly when you note that there are now more private providers of healthcare services than public providers like UBTH. This is why we in Edo State have established a compulsory health insurance scheme. In addition, just as General Godwin pointed out in his speech, we are investing in infrastructure and strengthening our primary healthcare network while improving the institutions where we train our healthcare personnel, like our nursing schools and our schools for medical health technology. Core to our healthcare strategy in Edo State is to emphasize our key function as a government, which is to regulate the healthcare system and the practitioners of the healthcare system in Edo State. These activities will go a long way to help strengthen the structure of healthcare in Edo, and while we take advantage of the existence of UBTH as the foremost research and training healthcare institution in this area. Finally, I want to applaud the management and staff of UBTH for their services over the past half century and hope that working closely together, we will achieve our aspiration of becoming the main hub for medical tourism before the next 50 years. On behalf of the government and people of Edo State, I congratulate the University of Benin Teaching Hospital on your 50th anniversary and Golden Jubilee. Congratulations.
The strategic location of UBTH about halfway between the eastern border and the western border of Nigeria, and also in Benin City as a gateway to the Niger Delta region, gives this hospital a central role in the national strategy to build a resilient health system by ensuring the availability of critical services within reasonable travel distance. The UBTH has, over and beyond that, begun to profile itself as a major center of excellence and is building up his own reputation in cancer treatment. Very soon we'll be getting more assets for cancer treatment, radiation. And then also now the Center of Excellence for South Sickle Cell Anemia, and they are also profiling themselves as a center for bone marrow transplant. Again, I commend them for their program to train paramedics.
This is a significant milestone, not only for the hospital, but for Edo State, or let me say, for the old Midwest, Edo and Delta now, isn't it? But this is not only for Edo State, but for the entire nation, as UBTH has been a cornerstone of healthcare delivery in Nigeria since its inception. As we look back over the past 5 decades, we can take pride in the tremendous progress that has been made in healthcare in Nigeria. And University of Benin Teaching Hospital has been one in the forefront of this progress, providing world-class medical care to Nigerians and training the next generation of healthcare professionals. UBTH has met and exceeded our expectations and has become a beacon of hope.
Can we put our hands together?